Yes, so radiomics is a fairly novel area of research, which is looking at subclinical data within scans for patients. So subclinical meaning that we know that when we do a scan for a patient, a radiologist will report the scan and we'll get a report from a radiologist's subjective opinion of what the scan looks like. But we know that these scans contain a lot of digital information which is not clinically perceptible. And what radiomics does is it tries to extract that information that we can't see clinically, and we can use that extracted information to determine a number of factors. And it's being used a lot in the literature to try and predict response of individual metastases to stereotactic radiotherapy. But where it has been used a lot less is in terms of trying to predict when metastases will occur before they're able to be viewed clinically. And the advantage that would have is it would allow earlier treatment. And if we treat metastases earlier when they're smaller, they respond better to stereotactic radiotherapy and the side effects will be less because we can irradiate a smaller volume of healthy brain tissue. So using radiomics to predict brain metastases is certainly in its infancy, and it's a topic that our group is looking at, but we've yet to publish anything on it yet. The initial outcomes are showing that it doesn't seem to predict brain metastases before they're clinically variable, but this is certainly something in its infancy. And if we were able to get more data out of it, and if it's something that does end up correlating with predicting early brain metastases, then this would have a direct impact on the standard of care we could give for patients in terms of treating the metastases early. So, I mean, in summary, it's in its infancy. We don't have any data yet to show that radiomics can be used to predict brain metastases. But if we get more data into this context, then we may be able to use it in the future.